Hi, Dr. Paul Kramer here again. And on previous videos we talked about bones being out of place in a way that your body can't self-correct. And the reason that the body doesn't self-correct those particular misalignments is because you don't have the muscles to do it. And between C7 and L5 you don't have any muscles that pull straight back. That is the major problem with the human body. It's not really a problem, because if you had those muscles, the body would have to be designed completely different and it probably wouldn't work. But a problem with the body is that a misaligned bone in between C7 and L5 that goes forward, you don't have muscles that are in back of it that would retrieve it and pull it backwards. So in this diagram, we have all the muscles here of the upper body. And what I want you to see is that as that bone misaligns and the body goes down and forward, look at the shape of the muscles as that body goes down and forward like that. Look what happens to the chest here. Look what happens to the muscles and the angles of the muscles here in the neck. All those angles change, and what ends up happening, especially back here in the back of your neck, because of the loss of leverage, these muscles have to pull a lot harder. And that's why people get chronically tight necks, chronically tight shoulders, because these muscles now have to pull a lot harder to keep the head upright. These muscles here that connect to the jaw have a different angle, and this can cause a lot of TMJ problems, or problems with the jaw joints. And it also causes problems up here where these muscles start to tense up because of all the shifting of these muscles here. It also causes breathing problems because, as you notice, if you look at this part of the chest, it's kind of caved in up here, and it's different than when you're up like this. And you'll notice every time you come in for treatment that after the treatment, I have you breathe in, breathe out, relax, and let your body slump. What I'm doing is checking to see how that area moves in there, and if there's any area that is collapsed in the chest that's not moving correctly or not well as it could on that visit. And sometimes after you breathe in, breathe out, relax, and let your body slump, I go, okay, that's enough for today. Other times I'll say, whoop, wait a minute, and we have to do some more adjusting in the spine, or I have to lift up on your ribs or do something else. What I'm doing is making sure that that chest is functioning correctly and that your breathing is as good as it can be that day. But you know, I get questions often about having massages and things like that, and I don't think that these are things that are harmful or anything, but you have to also understand that yes, you can work on these muscles and move the toxins out and work on those structures to break up any scar tissue or things like that, and that's good. But those muscles won't be chronically tight if these alignment issues are not fixed. And those alignment issues can only be fixed by addressing the bones that are out of place in a way that your body can't self-correct. And you'll find that once you get those bones realigned and get rid of the things that your body can't self-correct, your body pops up all by itself, and most muscle problems will go away on their own. You just have to get everything lined up. Once everything's lined up, the muscles relax, and people find that they really don't need to have massage or any, at least not any heavy-duty muscle work.